bringing you the latest developments on emerging viral threats worldwide. In today's report, we'll cover recent discoveries and outbreaks, providing you with accurate and comprehensive information to stay informed. Researchers at the Wuhan Institute of Virology have identified a new bat coronavirus, designated HKU5CoV2. This virus closely resembles SARS-CoV-2, the pathogen responsible for the COVID-19 pandemic. The study, led by Dr. Shi Zhengli and published in the journal Cell, reveals that HKU5CoV2 can bind to the human ACE2 receptor, facilitating potential cross-species transmission. While the virus has not been detected in humans, its ability to infect human cells underscores the necessity for vigilant monitoring and further research to assess its zoonotic potential. Health authorities in Ireland are addressing a significant increase in norovirus cases, commonly known as the winter vomiting bug. In the first 5 weeks of 2025, 261 cases were reported, a rise attributed to the emergence of a new variant, GII.17. This variant has also been identified in the UK and the US. Symptoms include sudden onset of vomiting, diarrhea, slight fever, headache, and stomach cramps. The Health Service Executive, HSE, advises the public to stay home if symptomatic and to avoid visiting hospitals or nursing homes to prevent further spread. A recent mutation of the H5N1 avian influenza virus has been identified in a critically ill patient in Louisiana. This mutation may enhance the virus's ability to infect the upper respiratory tract, potentially increasing transmissibility among humans. However, experts, including virologist Dr. Angela Rasmussen, caution that while these mutations are concerning, there is currently no evidence of increased human-to-human transmission. The Centers for Disease Control and Prevention, CDC, continues to focus on containment efforts. Cases of human metapneumovirus, hMPV, a respiratory virus, are on the rise in China and have shown an increase in the UK. While hMPV typically causes mild cold-like symptoms, it can be more severe in young children, the elderly, and individuals with weakened immune systems. Health authorities emphasize that hMPV is not a novel virus. It has been recognized for decades. The World Health Organization, WHO, notes that the current increase aligns with seasonal respiratory infection patterns, and no unusual outbreaks have been reported. An outbreak of Oropouche fever began in December 2023, with over 9,852 infections reported, including the first cases outside the Amazon region. While most cases have occurred in Brazil, local transmission has also been reported in Bolivia, Peru, Colombia, and Cuba. The virus is transmitted by biting midges and can cause symptoms such as fever, headache, and muscle pain. Health authorities are monitoring the situation closely to prevent further spread. Since September 2023, a new variant of the mpox virus, Clade IB, has led to over 29,000 cases and more than 800 fatalities, primarily in the Democratic Republic of the Congo. The World Health Organization declared the epidemic a public health emergency of international concern on August 14, 2024. Efforts are underway to control the outbreak, including vaccination campaigns and public health interventions. Rwanda reported its first-ever outbreak of Marburg virus disease on September 28, 2024. The outbreak resulted in 66 confirmed cases and 15 deaths. The Rwandan government, in collaboration with international partners, implemented measures including contact tracing, quarantine, and vaccination trials. The outbreak was declared over on December 20, 2024, after no new cases were reported for 42 consecutive days. On July 16, 2024, health officials detected circulating vaccine-derived poliovirus type 2 in sewage samples in the Gaza Strip. This marked the first appearance of poliovirus in the region in 25 years. A 10-month-old unvaccinated child was confirmed to have contracted polio, leading to concerns about potential spread. Vaccination campaigns have been initiated to curb the outbreak and protect the population. Staying informed about emerging viral threats is crucial for public health and safety. Authorities worldwide are actively monitoring these situations, implementing preventive measures, and conducting research to mitigate risks. The public is encouraged to follow health guidelines, stay updated through reputable sources, and participate in vaccination programs where available. Thank you for joining us for this comprehensive update on emerging viral threats. Stay safe and informed.